Hello everyone. Today we discuss about case presentation on eclampsia, subject OBG. First it come to identification data. It include age, name, age, sex, education, occupation, religion, language, nationality, address, diagnose, eclampsia, date of admission, name of hospital, ward, bed number. Then it come to chief complaint of the patient. It is rare but serious condition where high blood pressure result in seizure during pregnancy. Seizure are period of disturbed brain activity that can cause episode of staring, decrease, alertness, and conclusion. Present medical history. There is significant present medical history of Miss Ravina has high BP. Past medical history. There are significant of past medical history of Ravina, that is hypertension, seizure, decrease, alertness. Next, it come to family history, name of family member, relation to patient, age, sex, education, and marriage status. These are the family member of the patient. This is the data as shown in this. Then it come to the family tree. The square is male and the circle is female, and the square filled with the color is patient. Then it next come to medical examination. Present status is good, general condition, good awareness, where BP normal, general status, head normal, form normal, hair black color, eye normal, neck enlarged, trachea in middle, no marks, scars. Throat large, pulmonary inspection, shape in symmetrical, vocal is normal, heart inspection, cordus is not palpation and population left of cord. Abdomen inspection normal, palpation, tiredness, vision, typhoid abdomen, and skulls bowel. Extremity superior warm, abdominal edema, inferior warm, oral edema. Investigation, lab investigation, complete blood, leukocyte, red blood cell, HB, SCT. Then come to the introduction of eclampsia. Eclampsia is commonly defined as new onset of the grand mal seizure activity or explained coma during pregnancy or postpartum in women with a sign and symptom of preeclampsia. Most cases of eclampsia present in the third trimester of pregnancy, with about 80% of eclamptic seizure occurring in partum or with the first 48 hours following delivery. There are many factors which lead to development of preeclampsia and eclampsia. These hereditary factors are genetic, immunological, endocrinological, nutrition, and infection. Risk factor: gestational and chronic hypertension, being older than 35 years or younger, pregnancy with the twin or triple, first time pregnancy, fifth diabetes or another condition that affect your blood vessels, sixth is kidney disease, pathophysiology, placenta, hyperfusion, constitution of small alternate, reduced blood flow to multiple organs, increased vascular permeability, shift of extracellular fluid from the blood to the intestinal space. Then it come to the clinical manifestation. Clinical asymptomatic headache, visual disturbance, edema, high BP, fluid retention, breath reflection, and fluid level less than approximate. Diagnostic criteria made after 20-week gestation, new onset hypertension, new current significant proteinuria. For the sudden edema may also be present. Nursing diagnose. First, nursing diagnose decrease in the cardiac output due to the shifting of the fluid from the vascular to intestinal space. Second is deficient knowledge. The client with eclampsia disorder may not be aware of process that can lead to development of disease. Risk for the imbalance fluid. No fluid relation is command expected. Ineffective tissue perfusion, pregnancy care, retardation in the maternal blood and nutritional flow through the place, and edema, the oxygen available to fetus. Then it comes to NCP. First is it include assessment, nursing, diagnose, goal, planning, implementation, evaluation. And then first is subjective data, objective data. The cloud report absence of dyspnea. Objective the client alternative level of condition wants. Decrease cardiac output to make normal cardiac output. Planning assess the blood pressure and pulse every over. Assess the mean arterial pressure. Assess the crack visual. Assess the client. Assess the neurological status. Implementation. Blood pressure of client assessed. Meanwhile, arterial pressure is assessed. Good pulse and wheels are assessed. Neurological status of client are assessed. Evaluation cardiac output increase become normal up to some extent. Then it comes to next assessment, nursing diagnosis goal, planning, implementation goal. Subjective data, patient request for information. Objective, patient have no knowledge about the disease. Nursing diagnose deficient knowledge, and goal to make patient knowledge about the disease. Planning, assess the client and the knowledge of the disease process. Provide information about the sign and symptom of the disease. Inform client health status, result of the patient and fetal well-being. Implementation, the knowledge of client is given and information about the symptom and the sign of the client is given, and the client have educated about the status of the result of the disease. Now the goal able to tell about the eclampsia. Next it come to third NCP, assessment, nursing diagnosis goal, planning, implementation, evaluation. Subjective, that the client verbal understanding of need of clearance. Monitoring of whey, BP, urine, protein, and edema. Risk for imbalance excess fluid to balance the excess fluid. Assess the sound and respiratory rate and effort. Assess the client vital sign. Monitored BP, pulse. Assess the pressure of the edema and the degree of pitting edema. Lung, skate, and respiratory effort. Assess vital sign of client are assessed. Presence of edema is assessed. Now client verbally has understand of BP, urine, protein, and edema. So this is case presentation on eclampsia. Hope you get information from this video. Like the video and subscribe my channel for more video, and share this information to friends who need this. Thank you.